sprains, strains, and other soft tissue injuries. As I said in the previous video, sprains happen to your ligaments, and strains happens to your muscles. Muscles, tendons, and ligaments are made of strong, fibrous connective tissue. Ligaments are the ones that hold one bone to another bone. And of course, muscles are anchored to bones with tendons, which are exactly like ligaments. A tendon starts out attached to a bone, surrounds a muscle, then attaches to another bone. A tendon is thick and fibrous, then it expands out and turns into a thin sheath of fascia that surrounds the muscle belly. After this thin fascia passes the muscle belly, the tendon becomes a tendon again as it attaches to the next bone. Muscles, tendons, and ligaments can tear with a whiplash injury. Your spine is full of muscles, tendons, and ligaments. Your neck has many tiny muscles, and some of the muscles in your spine are so tiny, and there are so many of them, that we think that they exist not so much as bone movers, but as nerve receptors. This is why I always tell my patients that the spine is the biggest balance organ in the body. Posture and movement is signaled from these tiny muscles to your brain for balance information. So what happens to a muscle or ligament when it tears? These parts go through different stages of healing. The first stage of healing is the acute destruction phase. Muscle fibers tear, ligaments tear, and tendons tear. This acute injury releases inflammatory fluids from the blood, and a blood clot forms on the jagged edges of the tear to help start the healing process. The inflammatory fluids released by your own body can be just as destructive as the injury itself, but this inflammation is necessary for healing. The problem is that the inflammatory process is overkill in a closed wound. There's no chance for infection from foreign invaders like bacteria, but the body doesn't know that. This destructive and inflammatory phase can last 1 to 3 days. The second phase of healing is the repair phase. In the repair phase, 3 main things happen. White blood cells start to clean up dead tissue. Muscle fibers and ligament fibers start to be formed in the torn area of your muscles, and this bridges one side of the torn tissue to the next. The collagen fiber that is put in during this phase is weak, immature collagen, and these fibers form a framework in the injured area. Scar tissue then starts to get laid down on this framework, and finally, new capillaries start to grow into the area. These capillaries bring fresh blood to torn tissue. This repair phase lasts for 1 to 3 weeks. The third phase of healing is the remodeling phase. This is where the immature collagen fibers from the repair phase are slowly being replaced with stronger collagen fibers. New muscle fibers start to pierce through your scar tissue, and they seek to replace your temporary scar tissue with functional parts. In muscles, the remodeling phase is very fast. Your muscles can be fully remodeled and up to their full strength in as little as 7 days. However, ligaments can take up to a year to reach 80% of their full strength. This can depend on the area that was injured and the severity of your injury. It's interesting to note that steroids like corticosteroids can slow down the healing process. Anti-inflammatory medications, it turns out, can also inhibit the healing process. Gentle movement is the best way to help your body heal from these soft tissue injuries from within. The collagen fibers that get laid down in the repair and remodeling phases respond really well to the tensile stretch of movement. Too much aggressive movement can restart the damaging inflammatory process, but gentle movement feels good and it's intrinsically healing. Stretches help, light massage helps, and exercise helps. And finally, chiropractic care is an important part of the healing process because chiropractic care helps restore movement to stuck joints. Usually there are parts of the spine that don't move through their full range of motion, and chiropractic care works on that. A chiropractic adjustment that specifically treats the joints that don't move well feels great because it releases pressure in stuck joints and it takes stress off of the other adjacent bones that have been under too much stress. Chiropractic care helps the healing process by providing normal tensile stretch to injured areas by promoting proper movement. And finally, chiropractic care provides a pain-relieving reflex in the spine and brainstem so you can cut down on the medications that you take.